Access Healthcare Services was founded in 1998, so it was shortly before I began working with the organization. My name is Tammy Heen. I'm the Director of Client Services. I've been with Access Healthcare Services since 1999. When you're working in community healthcare and everything is so remote and people are very, very independent in what they do, support is imperative. And when it comes to what we're doing, we need to have the tools in place, but we also need to have the support to use them and the support to learn them and understand them. And so whenever we adapted AlayaCare, the support that we felt from the team at AlayaCare was immediate. That was an absolute immediate success for us.
My name is Delana Wood. I'm the Director of Business Development and Project Management with Access Healthcare Services. I think my experience with AlayaCare is nothing but fabulous. What an energetic, fabulous team, and openness and willingness to listen and honesty.
Cheryl Teeter, I'm the Manager of Quality Assurance at Access Healthcare Services. So I work really closely with AlayaCare. I monitor a lot of the metrics, the KPIs. I report to the directors and the CEO. We had a collaborative approach with AlayaCare. So right from the beginning, they were really great in working with us as to what our needs are throughout the whole process, even to this day, a year later.
Whenever we're looking at measuring success, I think that if you speak to each person in this organization, they may give you a different answer. From this perspective, immediately we saw a 15% improvement in our mileage costs, which is huge from a financial standpoint, because if we can improve 15% of where we were when we implemented it, that 15% carried over as we grow is essential as far as really seeing something that's tangible to say this was a good choice, this worked.
In the past, we had to drive an hour and a half to get to the client's home, to review the paper chart, to figure out what was going on, to what's our next step, right? So in terms of client outcomes, we may not even need to make that drive. We may be able to talk the client through whatever the issue is over the phone once we have an understanding of what their teaching has been, where their situation stands. So just in terms of client success that way, I think that's been really helpful.
Not looking from a sustainability standpoint, but our missed care decreased. The fact that we know if there is a client out there within 15 minutes that somebody hasn't shown up, somebody is late. We have that opportunity with AlayaCare where it's right on the dashboard, every minute, every day. We know if our staff got there. We know if our client received their care. And if somebody didn't, we can look at why. And it's become much easier process now. Being accountable with an electronic verification has certainly created incredible efficiencies, and it's a sustainable process that we're really excited about, that we could see immediately.
I've worked with a lot of different client databases and electronic health records in my 30 years in community healthcare, and I think that as a young organization, you have a very dynamic, real presence, and you're willing to listen and you're open as an organization, and I can only say that is a gift to us because you listen.
I'm a huge AlayaCare supporter. I like Team AlayaCare all the way.